Good afternoon, everyone. I am Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to the Health Equity Forum. The Health Equity Forum is a virtual venue where we feature a thought leader or subject matter expert in public health, health disparities, and health equity. And today's topic is on improving workforce development for better health outcomes. So we know that research indicates that a higher representation of Black healthcare providers, particularly primary care physicians, is significantly linked to improved health outcomes for Black individuals, including increased life expectancy and reduced mortality disparities compared to our white counterparts. So essentially, areas where there are Black doctors tend to see better health outcomes for Black communities. So now we know that Black doctors here in California make up about 3% of the total number of physicians. Nationwide, it's about 5%. And also, according to the California Healthcare Foundation, here in California, the state's medical student education pipeline is not producing enough Black physicians. And unfortunately, half of California's Black medical students leave the state for residency programs and often don't return. So what can we do to ensure that there is a strong pipeline of healthcare professionals that look like the communities they will serve, and that there's a greater representation of Black physicians and healthcare professionals? Well, we'll talk about that today, and I'm honored to be able to have that conversation with Dr. David Carlisle, President and CEO of Charles R. Drew University of Medicine and Science. So we'll, in a few minutes, hear from Dr. Carlisle about what CDU is doing to address this issue. But before we start, I'd just like to cover a few housekeeping items. So we'll hear from Dr. Carlisle. He'll share a few words about what Charles Drew is doing and update us on all of that information. And then we'll have a conversation about improving workforce development for better health outcomes. You'll also have an opportunity to ask questions, so please put your questions in the Q&A box. If you want to give a shout out to somebody you know and you see here in the webinar, you can do that in the chat box, but please put your questions in the Q&A box. And just the final thing, everyone will remain on mute and off camera for the duration of the webinar. So before I introduce Dr. Carlisle, I just want to take a couple of minutes to talk about CBHN and who we are and what we do, in case you're not familiar with the organization. But we are the voice and trusted resource for Black health equity here in California. And we are a statewide organization that is dedicated to advancing health equity for all Black Californians. And we do that on a daily basis by conducting outreach, education, advocacy, and policy work, as well as programmatic work to really advance health equity, and doing that through the lens of critical issues that lie at the intersection of racial justice, social justice, and environmental justice. Next slide. So our vision is to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free of racism, violence, and health inequities. And our mission, which we work hard to achieve every day, is to ensure that all Black Californians, no matter how well educated they are, how much money they make, where they live, who they love, how they self-identify, or even what their housing status is, really has access to high quality, equitable, primary, as well as behavioral health care, and definitely not die from diseases that are preventable. And so next slide, please. And so I'd like to not take any more time, but introduce Dr. David Carlisle. He has been the president and chief executive officer of Charles R. Drew University of Medicine and Science since 2011. He is a published author on health policy, quality of care, medical education diversity, and eliminating health disparities. He is a board-certified internal medicine specialist and received his BA from Wesleyan University, his MD from Brown University, and his MPH and PhD in health services from the UCLA Fielding School of Public Health. Dr. Carlisle has served as the director of the Office of Statewide Health Planning and Development for 11 years, or otherwise known as OSHPD. Under his leadership, OSHPD, now known as the Department of Healthcare Access and Information, or HCI, released its first ever health disparities report and increased scholarship and loan repayment opportunities for health providers committed to practicing in underrepresented, under-resourced, and underserved communities. So today, Dr. Carlisle will share what Charles Drew's vision is for the future, is focused on innovation and plans to ensure that the unique needs of our community are met by cultivating a strong network and pipeline of diverse health professionals and leaders who are dedicated to social justice and equity for all of us. Dr. Carlisle, take it away.
Well, Rhonda, thank you very much, and thank you to all of your guests and attendees for being with us this afternoon. It's a pleasure to be here. It's a pleasure to work with the Black Health Network on an ongoing basis, and it's indeed a pleasure and privilege to lead the Charles R. Drew University of Medicine and Science, an institution that I know we're all very, very proud of. If I may, I'll go ahead and share with your audience just a few information slides about the university. So we'll go ahead and cue that up. Okay, and trusting that everyone can see this slide, I'll just say that our namesake, our nickname, is the Mighty Lions. That's who we are. We adopted that name about 10 years ago. Most people, or many people, I'm sure in the audience are at least somewhat familiar with CDU, have been on our campus, but many people may not. And I'll just say that we are named after Dr. Charles Richard Drew, who at the time of his premature passing was known as the father of modern blood banking in the United States, but also the chair of surgery at Howard University. The point here is that every time somebody gets a transfusion from a blood bank today in the United States and even around the world, they owe a little bit of thanks to Dr. Charles Drew for making blood banks happen. CDU is a private, not-for-profit institution. Our motto is a private university with a public mission. We consider ourselves a community-founded institution because we were founded after the Watts Uprising of 1965. Here we are. If you've not been to our campus, we are located between Willowbrook to the north, to the east, Watts to the north, and Compton to the south, right here in South Central Los Angeles. Here you see about a mile from our campus, the famous Watts landmark, the Watts Towers. CDU is now 58 years old, again, incorporated the year after the Watts Uprising of 1965. We're known for being, for our focus on primary care, our focus on diversity, more on that later, underserved area practice, biomedical science research, and pipeline programs such as the Saturday Science Academy 2, and our international work. Our biggest program right now is in Zambia as we speak, focusing on AIDS prevention. This is the seminal photograph in the LA Times from the Watts Uprising of 1965, just to make sure people can kind of understand the context for CDU. We are a federally designated historically Black graduate institution. We receive federal funds in the Title IIIB program. We're also a charter member of the Hispanic Serving Health Profession Schools organization. Here we are in South Los Angeles on this map. You can see us in Service Planning Area 6. The point about this slide is that SPA 6, with a population of 1 million people, is actually bigger than city populations of a number of these urban areas. For example, look at San Francisco, less than 1 million people. Look at Portland, Oregon, Honolulu, less than 1 million people, Baltimore, Sacramento. Especially look at Boston. Now I'd ask the question, how many teaching hospitals are there in Boston? There may be 20. How many medical schools are there in Boston? 3 or 4, depends on how you define it. And then the question is, of course, how many do you see here in Los Angeles in SPA 6? And the answer until recently was no medical schools and no teaching hospitals. A little bit about SPA 6, no surprise. It has disproportionately worse outcomes on prevention measures, public health measures, stroke deaths, infant death rate, et cetera, et cetera. There's an acute need for healthcare in the SPA 6 community. And that's in part why CDU was created. I mentioned, you heard a bit about our mission statement. Our vision is excellent health and wellness for all in a world without health disparities. Our point and why we're here is to train young people from the communities around our university, which are significantly under-resourced and underserved, and turn them into practicing healthcare professionals, many of whom will say to return to the communities they grew up in to make them a better place. CDU has been ranked recently in a number of areas. This is from the Brookings Institute, ranking us number 3 in the country as a value-added university, taking young people from challenged socioeconomic status beginnings and turning them into highly effective members of their communities and their professions by the midpoints in their careers. We have some other rankings as well. Number 2 in terms of student and faculty diversity, and you can see our demographics on the slide right here. We've also been ranked number 1 best master's degree program in biomedical sciences in the country for 3 years in a row. Also top ranked on return on investment for students, best graduate pay, and ranked number 5 by Forbes magazine. So the point is that CDU has been garnering some very significant national rankings. I want to shift to where we are right now. We are on a growth trajectory for this university, and you'll see that in more detail later. But this is from our current strategic plan. And the reason we're trying to grow is we recognize that here in California, especially, most of the pre-health profession schools are large state universities or large private universities, thousands of students. You don't see small nurturing institutions cultivating their students to go into the health professions like you see in other parts of the country, especially say New England or the Mid-Atlantic area. So there's a definite role for an institution that is small, cares about students, knows them by name, follows them significantly throughout the course of their education, especially students that come from under-resourced communities for whom much of higher education may be a significant challenge initially. So our goal in the short term is to increase our enrollment, which is right now about 1,000 students, to 1,000 undergraduates and 1,000 graduate students. We presently have about 350 undergraduates and about 650 graduate students at the university. And here you can see some of our programs. I want to start with the College of Medicine because people think of us as often a medical school, but we do have a medical school as one of the 3 colleges at the university. But the College of Medicine is our legacy program. And we also have our newest college, the Mervyn and Diamond Lee College of Nursing, with several nursing education programs that you can see here. We have a Doctor of Nursing Practice, 2 nurse practitioner programs, family nurse practitioner and psychiatric nurse practitioner programs. We have another master's degree program in nursing, the entry-level master's program, for students that have graduated from college and then decide later that they want to become a nurse. We have a brand new BSN program and some other RN to BSN and LVN to BSN programs as well. The College of Science and Health is actually going to become our biggest college down the road. And here you see that we've got 1, 2, 3, 4 undergraduate degree programs, psychology, biomedical sciences, public health, and radiologic technology. 3 MS degree programs, our PA program, our biomedical sciences program that I already mentioned. And next year we'll be opening a genetic counseling program. Then you've got the Master of Degree program in public health as well. And that leaves the College of Medicine. And this is where you see 2 significant types of programs. Of course, there's the MD program that we are well known for, and more on that later. But we also have our graduate medical education programs or residency training programs. The reason these are significant is that CDU's formative mission when we were established back in 1966 was to be the educational sponsor for the residency programs at the then new LA County King Drew Medical Center across the street from our campus. Those programs grew to encompass 13 separate residency programs at the county hospital. When the hospital closed in 2007, all 13 of those programs went away. And you can imagine the impact on what was already an underserved area at that time. So one of the great challenges that we've embarked on is to return CDU and to return South Los Angeles to graduate medical education. And now we have 4 separate residency programs: psychiatry, family medicine, internal medicine, and a new program, physical medicine and rehabilitation. We also have 2 fellowship programs, a child psychiatry fellowship program, the only one I think in the country in an underserved area like South Los Angeles, and a brand new addiction medicine program. So this is the array of the educational programs at the university, and including also two other programs. I mentioned the Saturday Science Academy too. This is a Saturday Science Immersion program that starts as early as age 4 and has people, students in it all the way through high school. And now we have students at the university who are graduates of the Saturday Science Academy. And then we also have a post-baccalaureate program for students that are applying to medical school. So across these programs, we have probably 23, 26 separate programs, and our current enrollment again is about 1,000 students. Coming up around the corner is a brand new PhD program in biomedical sciences as well. And here you see a photograph from the LA County Board of Supervisors where they voted to provide funding for us for our residency programs at CDU. And then there's our medical school. Here's a report, and I don't expect our audience to necessarily, and don't want them to try to read this, but recommendation 2.5 from the California Future Health Workforce Commission basically calls for CDU to open a 4-year medical school. That was a few years ago. Here we are today. We have our own medical school at CDU, and we have a preliminary accreditation from the Licensing Liaison Committee on Medical Education, the LCME. In about a year or two, we will advance that to provisional accreditation. And when we graduate our first class from the medical school, we will be eligible for full accreditation from the LCME. So we are alive, well, and growing in terms of medical school accreditation. This is what you will see in about 2 years when you come visit our campus. Right now, it's just a hole in the ground on 120th Street next to the King Drew Manning High School. But this will be a 4-story, 60,000 square foot building housing our new medical education program. And this is called, right now, the Health Professions Education Building. I want to close with a famous quote from Charles Drew. You can see it on the main entrance of our campus on 120th Street. Excellence of performance will transcend artificial barriers created by man. This is the mantra that we live by at CDU. And it is a direct quote and inspiration from our namesake, Dr. Charles R. Drew. So I will stop sharing slides right now and focus on a couple of other things. I know that we'll have questions from the audience, but I really want to say that a little bit more about our medical students. Our medical students are very unusual. They're different from the typical medical student in the United States. About 2/3 of them were Pell Grant recipients when they were in college. That is more than twice the national average among medical students. At least 1/3 of them are firsties. That is the first members of their families to go to college. That is more than twice the national average among medical students. If you stop one of our students on campus and ask them why they came to CDU instead of going to a UCLA or a Stanford or some other school, USC, they will typically say, I came to CDU because the mission at CDU aligns with my personal mission in trying to become a health professional. I can't get that at any other school. Hence, here I am at CDU. You ask them, what do they want to do as a health professional? They'll say, I just want to go back to the community I grew up in and make it a better place. You don't have students here who have grandmothers or uncles or parents who tell them how awful the health professions have become. No, they're only motivated to be a health professional because they want to make their community and the world a better place. That's the typical CDU student. And it describes not just our medical students, but all the other students at the university as well. I'll often ask them, where did you grow up? Where are you from? And they'll look at me a little bit slyly and they'll say, well, Dr. Carlisle, I grew up right around the corner. I'm from 120th and Central. I'm from Compton. I'm from Watts. I'm from Linwood. And when the students say that to me, I know that we're fulfilling and delivering on the mission that led to our creation 58 years ago. So Rhonda, I will stop here and let me know if there's anything else you want me to cover. And I know that we have some dialogue with our audience as well.
Yes. So thank you so much for sharing that information about CDU. There was actually some things that I didn't know that I learned today that were new to me. So thank you for that. And so I guess I'll start with one of the more recent significant things that has happened for Charles Drew. In August of 2024, CDU received a $75 million grant or gift from the Bloomberg Philanthropies to strengthen the school's operations, research capacity, and help to further build the endowment. So can you talk about how this will help shape the future of CDU and how it can impact also the cultivation of a more diverse workforce in healthcare?
And of course, the latter is a very important goal. And thank you, Rhonda. I'll just digress a little bit and then come back specifically to the question to talk about workforce. This is a critical need. This is why the state of California is investing in all sorts of health profession education programs. This is why the US government is investing in these programs as well. Michael Bloomberg, the former mayor of New York City, recognizes the importance of workforce training and workforce programs. And he is investing, in addition to investing in CDU, he's investing in the other 3 historically Black medical schools, Howard University, Meharry Medical College, and the Morehouse School of Medicine, with similar funding. In addition, he's also invested in the Xavier of Louisiana University new medical school that is about to open in a few years. So he is putting his money where his mouth is in terms of talking about workforce preparation. You know, I will say, Rhonda, just to give you an example, I was reading some years ago a novel from the Harlem Renaissance, written in the 1920s, a short novel, and I was entertained. It was a good book. And then I got to a section where the character is at a hospital, maybe Harlem Hospital, getting health care. And he's in a large clinic waiting room. And he knows that there are 2 doctors working in this clinic. One is Black, one is white. The door to the clinic opens, and the Caucasian physician beckons to the character and says, "Come on in, I will see you now." And the character says, "No, I will wait for the other doctor." He wanted to be seen by the Black doctor. So that is 80, 100 years ago. And even then, workforce considerations, diversity, were a significant issue for the population. I was surprised to see this. It told me that we've been working on this issue for more than 100 years. And now, you know, fast forward to Michael Bloomberg's gift, $75 million to our institution to basically make us a stronger institution, to grow our operations and grow our endowment.
Great. And you talked about you know, where CDU is located. And I think it's amazing that there are a lot of students that are coming from the surrounding community. So can you talk about like what percentage actually are from the LA area and the community versus those students that may come from other parts of the country or other parts of the state?
Well, as with many things, especially in higher education, you can slice the answer different ways. But I'll expand on that. It depends on how you define the students, whether you're talking about our total enrollment, the different programs. For example, our medical students, we know that about 80% come from the state of California. More than half of them, about 2/3, come from LA County. But if you actually look at where they went to college, of course, they went to college all over the country. But the reality is many of them are Angelenos, and they're coming back to Los Angeles to go to medical school. But we do have students in the medical school from all over the country as well. If you look at other programs, our radiologic technology program, virtually every student in that program is an LA County resident. Our nursing program is actually maybe more geographically diverse, with students coming from states like Nevada, cities like Las Vegas, parts of Texas, parts of Florida. So it really depends on what the programs are. But on average, about 70% of our students' body at the university is or has been at one time a resident of Los Angeles County. And for many of those students, yes, they grew up right around the corner from our university. And again, they just want to be doing everything they can to make their neighborhood that they grew up in a better place. And you don't see that kind of resonance at most other universities.
Great, great. And so you talked about the medical school, and the program began in the fall of 2023. So the first class will graduate about 60 students. Is that about right?
Yeah,
And-
we're matriculating 60 students per year.
okay,
That is an accreditation defined limit for us. At some point, when we're fully accredited, we'll go back to the LCME and say, hey, we've done a good job so far. How about giving us a higher cap for enrollment? I expect the answer will be yes at that time.
great.
So it'll be received positively by the LCME, and we'll expand our enrollment.
Right. And then you also mentioned that quite a few of the students are Pell Grant recipients, in addition to being from the local community. So can you talk about, the diversity of that class, and then how is CDU also training them to provide more culturally competent care to the communities that they will go out to serve?
This is actually a really interesting point, Rhonda. I'm often asked, what are you doing at CDU that is innovative? And my response is, we're innovative just because we're here, and because of what we do in terms of our mission. That makes us stand out significantly among all the other higher education institutions that you can see. But specifically in response to the question within the medical school environment, every class that we have focuses on under-resourced area practice. And that's an important consideration for us. Our students hear this all the time, but they're also selected because they bring this with them. They bring a sense of what it means to be or experience in being an underserved area, under-resourced area practitioner. They know this already. And we're basically taking that edge that they have and sharpening it and refining it even further. They have a pre-enrollment curriculum that they go through where they learn more than they even knew coming in about what it means to be an under-resourced area practitioner. So this is just part of everything that we do at the university. Again, it's part of our mission statement. Our students in all the programs hear about this priority, this mission all the time. And again, it makes us unique as a higher education institution.
Great. And you mentioned that CDU is one of 4 historically Black colleges or medical schools in the country, and CDU is the only one in the western part of the country. But we know that as a result of the Flexner report, 100 years ago, there were more Black medical schools than there are today. And we know that that has had a significant impact also on the number of Black physicians that we have today. So can you talk about a little bit more about how schools like CDU, Howard, Meharry, and Morehouse are really working to fill the pipeline and ensuring that there are definitely more Black physicians and healthcare professionals that look like us and serve our community?
And you cited the 3% state number or percentage and the 5% national proportion earlier at in the introduction. Let me elaborate on that just a little bit. When we matriculated our first class, a friend of mine sent me some data on the diversity of California medical students. With us, there are now 13 medical schools in the state of California. So this data showed that in 2022, there were a total of 260 African-American, Latino, and indigenous underrepresented students in the state of California, first-year medical school classes, 260 students. About 100 of those, roughly speaking, of the 260 were African-American at that time. You look at our medical school medical student demographic, and we are about 52% African-American, 48% or so, 47% Latino in the first class. You look at that 52% of 60, let's say 31 students. That increased the total number of first-year African-American medical students in the entire state of California by well over 20% in that first-year group, all by ourselves. We increased that number by over 20%. The same is true for Latino medical students, although they're more distributed across California medical schools. We increased the Latino medical student enrollment by over 10% in the state of California. So this little school with 60 students per year has already had a dramatic impact on the diversity of California medical students. I think it shows actually how challenged the other medical schools are in this regard.
Thanks. And then, I also mentioned earlier about the correlation between having more Black physicians available in communities that serve Black communities and health outcomes. Can you elaborate a little bit more about how the increase of 20% that you mentioned will impact health disparities, and especially in the SPA 6 and other parts of California, perhaps?
Yes, these medical students with a priority on primary care, but not a limitation to primary care, will go out into their professions, and they will be constantly practicing or considering how they can impact under-resourced communities. This is a major consideration for us. This is, again, is why we're here as a university and why we're here as a medical school. They will bend the curve effectively, whether they stay here in South Los Angeles, they're practicing elsewhere in California, elsewhere in LA County, elsewhere in the country, maybe even elsewhere around the world. They will be focusing on the needs of under-resourced communities. And this is exactly what our mission is here to do. They will have an impact. And you look at the impact of a physician by themselves may employ or lead to the employment of maybe 25 other people. They will have panels of thousands of patients that they're responsible for. This is not a trivial impact. The California Healthcare Foundation, I'm on their board, recently published a survey on the health of African American and Black Californians. And it was abundantly clear that for African Americans, trust is still a major issue. Here we are again, 100 years after the Harlem Renaissance, and trust is still a major issue. Does your healthcare provider respect you? Do they value you as a human being? Do you feel compelled to dress up, to be looked at a certain way when you go to the doctor, to speak a certain way? Are you respected? One of the benefits of having students from this community in all of our programs is they can look at a 90-year-old African-American woman unconscious on a hospital gurney in the emergency room. And they don't think of that person as a 90-year-old African-American woman. They think of that person as, maybe she could be my grandmother. They look at a 17-year-old after a traumatic accident, and again, in the emergency room, and they think, that could be my kid brother. They look at patients of color a different way when they see them than the healthcare system does typically. And by increasing diversity, that is one step that we make in the right direction.
Yeah, sounds like there's a lot more human kindness that happens with the individuals that go through your medical school program, because they are able to better connect and relate to the individuals that they take care of. So I think that should happen in all of medicine, but unfortunately, as we know, it doesn't. And also, thank you for mentioning the Listening to Black Californians research. We also partner with the Healthcare Foundation to implement one of the recommendations that came out of that. So our health education series on making the healthcare system work better for you actually came out of that work. So thank you for uplifting that a little bit. And so, go ahead.
I was going to say thank you. Yes.
Sure. Yes. So one of the other great things that has happened in 2024 for Charles Drew is that you now have a partnership with Sutter to address the physician shortage and also health inequities across California. So can you share how this partnership came about and what is the impetus for it?
Well, this is really a synergistic or symbiotic relationship between maybe the largest healthcare delivery entity in Northern California and CDU. You might ask the question, what is Northern California? 300 miles away. I think the closest Sutter facility is in southern Kern County, maybe 100 miles away from, or 150 from Los Angeles. But why Sutter? And Sutter basically said, we need more diversity within our organization. They have a new CEO who came from the Ochsner Clinic in New Orleans. New Orleans, of course, is one of the most diverse urban environments in the United States. So he is used to thinking in terms of diversity. And he saw an opportunity for Sutter to achieve greater diversity. We were brought together by an African-American physician in Sutter initially, and the Palo Alto Medical Group Foundation in order to talk about why diversity matters. And they embraced us. And for us, we have an issue which every health professions program around the country is facing today, which is a shortage of clinical opportunities, clinical education opportunities, clinical rotation opportunities. As healthcare becomes more and more squeezed financially, those opportunities are less and less available to educational institutions, and healthcare education is challenged as a result. Sutter is not doing a lot of education, but they have plenty of sites to do it, to practice education at. And they basically said, well, we can bring your residents, your students into our facilities, and you can get more rotations. So for us, it was a win-win, and we're very happy to have this arrangement.
Yeah, and so as I understand it, I think there's two significant initiatives that are part of that partnership. Can you talk about exactly what they are?
Well, they have provided us with already, I think we're in the first year of funding with $7.7 million of medical student scholarships. So that's a great help to us. They're also, as I mentioned, giving us training opportunities, rotation opportunities, particularly, for example, in neurology, in pediatrics, in obstetrics gynecology, very, very challenged educational environments here in Los Angeles. And we're also going to be working with them on some research programs focusing on disparities research. And they're very, very interested in this as well. You know, Sutter operates probably the most significant healthcare institution in Oakland, Alta Bates Medical Center. They operate the similar institution in Sacramento, the Sutter Sacramento Medical Center. And so they're very involved in urban healthcare in Northern California.
Great. And then how do you think this partnership will actually clear paths for medical education, I mean, you talked about that a little bit, but can you go a little bit further around like how this research and all the things that are part of that partnership will have a greater impact on health outcomes for Black communities across California?
Well, throughout California, you know, Sacramento, for example, Sacramento County is a highly diverse urban county with a very high percentage of African-American residents. So our students will see the African-American and the urban underserved health experience in a variety of settings, not just the Los Angeles setting. And this will, I think, expand their horizons in terms of their cognitive capabilities as urban health practitioners. Sutter, of course, does a variety of cutting-edge healthcare things, and transplants, and I mean, you name it, Sutter's doing it probably in healthcare. And this is an experience that you can't get everywhere. And so our students will be exposed to the most cutting edge of healthcare delivery technologies through Sutter as well, which they receive in other venues even closer to home. But Sutter can expand that availability for us.
Great. There are some questions in the chat, in the Q&A box, and I will share, but thank you for engaging in a conversation about all the amazing things that are happening at Charles Drew and what the future holds for your programs there. And so thank you, Ms. Tia. Tia wants to know, this expansion is phenomenal and extremely necessary. She's wondering what steps are being done to ensure diversity is involved in recruiting instructors and support, support education staff.
Well, if you come to our campus, the answer is kind of self-evident. Recall that we are the second-ranked university in the entire country in terms of faculty diversity. If you look at our student diversity, we have twice the number of African-American students enrolled at our university as any other higher education institution in the state of California. Diversity is in our DNA. We will always be a diverse institution. We are bringing diversity in faculty diversity and student diversity to the state of California. And by getting bigger, we'll just make that even more true.
I can attest to that. I've been on campus a few times, and even 10 years ago when I first came to California, was doing some work with Dr. Bagama in breast cancer, and noticed the level of diversity of the faculty in addition to the students. And so I definitely have seen that most recently when I visited campus. So I think, don't know what the percentage is, but I think you probably are leading the state and other medical schools when it comes to having a more diverse staff. So that's fantastic.
Yeah, to that point, Rhonda, I can't cite specific numbers, but I think you'd be hard pressed to find a medical school in the entire United States, especially in California, that can say roughly half of its medical students are African American and roughly half are Latino.
Great. Yeah. So Lauren wants to know, how can we provide more resources for the community to reduce health inequities? And then, are there community or patient navigators who may assist the community in accessing equitable health care?
The latter part of that question is really interesting. I can't speak to it directly. I know that we have with Altamed, we have a community health worker program based on the Promotora model. So we are active in that space. I can't tell you how many people are in that program right now. But if you were on a campus, you would see I think 3 or 4 vehicles with CDU logos and colors on them, and they're basically community health vehicles. They go out into the community. We really expanded this work during the COVID-19 pandemic, but this is modeled on the work of Professor Cynthia Davis, who decades ago became the first person in California to be doing AIDS, HIV outreach and testing, and became the major prototype for how this can be done successfully throughout the entire country. So we built upon that model very successfully. And now today we go out into the community several days a week to do exactly that, to connect community members with healthcare services, but not just to provide care, but to provide advice about care as well.
Right. And then there was a whole big street medicine program during COVID that I think you worked with Dr. Abraham, Jerry Abraham.
Oh, absolutely. Yes. Yes. Dr. Abraham from Kedron Health. Yes.
Yeah. Can you talk a little bit more about that as well? Because I think that was amazing in terms of the number of people that were able to get access to the COVID vaccine.
Dr. Abraham is on our faculty, and together we created this street medicine focus. The healthcare vans that we utilize are part of that street medicine program, and there are any number of individuals in South Los Angeles who are getting care or getting healthcare needs addressed because of our street medicine program. Now, of course, in Southern California, street medicine is an important thing, whether you're talking about Venice Beach or right around the corner from our campus. But we have unhoused individuals who have very, very impaired access to healthcare. We're making sure that access is improved through our street medicine program.
Great. And this is a question that was actually placed in the chat, but someone wants to know, is there any advice on how to protect themselves, their career, if they discover and blow the whistle on an inequity found within the healthcare system?
Well, that's a really important question. It's a complex question. The answer is probably going to be pretty complex as well. I would say the important thing is to maintain one's awareness of this as an issue, because it's a big issue for our country. The Commonwealth Fund just issued a report about comparing the U.S. healthcare system to that of other industrialized nations. And everyone knows here, I'm sure, knows that we lag behind other industrialized nations in terms of any healthcare outcomes. And sure enough, on this most recent report, we did as well. I would say my thesis would be that it's in large part because of the lack of healthcare, successful healthcare, that is rendered to members of under-resourced communities. And CD wants to make sure that somebody who's a resident of Bell Gardens gets the same quality healthcare that a resident of Bel Air gets in LA County. And that's what we are here to achieve and eliminate health disparities. So I would say, in answer to the question, that one important thing that a future healthcare professional should consider is keeping their eyes on the prize of eliminating healthcare disparities, no matter where they are and what they're doing. They can be a Beverly Hills dermatologist, and they can see patients of color who need access to dermatologic health care and do a better job than the next person can who doesn't have that same orientation. That's important.
Great. And next question, Barbara wants to know, what are your plans in anticipation of what will happen under their new administration and vows to disband DEI programs?
Diversity is one of our values. Equity is in our mission statement. This is what CDU is all about. We will remain true to those values and that mission, regardless of any external forces that are applied toward us. This is our promise to the state of California. This is why we are a California not-for-profit institution. It's probably too early for me to respond specifically about how the incoming administration may change DEI, specifically considerations, or may change, for example, the Department of Education. We know that there have been statements that change is forthcoming. We will have to see what that change will entail. For example, we receive our Title IIIB historically Black funding from the Department of Education. For example, Title IV programs that provide federal student loans to students across the country are run out of the Department of Education. These are programs that are integral to higher education in the entire United States, and especially here in California. California, I think, has really been steadfast in saying these are the state's priorities. And when I go to Sacramento and talk to California health policy leadership, and they are certainly aware of Charles R. Drew University of Medicine and Science. They're aware of us, they value our contributions, and they want to do everything they can to ensure that those contributions will continue into the foreseeable future.
Great. And someone wants to know, is the master's program in person or online, or maybe both?
Is that public health, Rhonda, that they're referring to?
They didn't specifically say, it's just master's program, but let's assume it's the MPH program.
Yeah. So we do have, I think, 5 master's degree programs at the university, including our PA program, for example. But in public health, it is basically a hybrid program. So I give a lecture every year that started out in person during the pandemic. It became online. It'll be online this year, but some of the classes are taught in person as well. So a hybrid program, yes.
Oh, great. And then someone also wants to know, are there any plans in the future for a pharmacy school program?
Really interesting workforce question. And I would say that when you look at your average pharmacist that you encounter at a pharmacy, they're typically not African American or Latino. But if you drive around the neighborhood here, you will see some old pharmacy buildings that were operated by African American pharmacists. There's a need for African American pharmacists, to be sure, and Latino pharmacists to serve our communities. But if you look at the enrollment at pharmacy schools, that enrollment is actually dropping. I don't know enough about it to speak to why, but I think we'll be challenged to produce more pharmacists in the future. In saying that, I know that we need to make sure that that diversity of those pharmacists, those future pharmacists, remains a priority for the state of California. Pharmacy is an interesting profession. And because of that, because of those considerations, we've not focused on pharmacy schools yet. I might say that there might be a more compelling need, for example, a dental school in South Los Angeles. You see billboards at bus stops around LA County. Your tooth hurting you, we'll yank it out for $39. That is not state-of-the-art dental care. And I'd say that's an issue as well.
Okay, great. And then someone wants to know, are CSU credits transferable to Charles Drew?
Yes.
Okay, great.
As well as California Community College credits.
Okay. And then are there any plans to expand the public health program, and is the BS program accreditable or accredited, sorry?
Yes, the BS program is accredited under our General University Accreditation, the WASC, but it's also included in the public health accreditation that applies to our master's degree program as well. We are actually, we just received or said goodbye to the public health accreditation site visit team. We are on the cusp of a re-accreditation for public health. I will say that our public health programs are among the minority of public health programs in the United States that are accredited. CDU's program is accredited, and that puts us at a higher level than most programs in the United States. We do intend to expand, or we'd like to. I wouldn't say we have specific plans to expand, but I would expect that 10 years from now you'd come back and see a greater number of MPH students, a greater number of BS students in public health, and also doctorate of public health students at CDU.
Great. And then this might be a potential partnership opportunity for CDU, but this is someone who represents the Caribbean Basin Institute for Education and Culture. It's a California nonprofit, and that person is assisting the Embassy for the Republic of Cuba, who is interested in establishing a relationship with CDU. So she would like to connect somehow to continue or have a conversation with you about establishing trials on groundbreaking medical advancements in particularly diabetes, which we know disproportionately affects Black American, Black Californians. So
yeah, thank you for that question. It's a really interesting one. I'll say a couple of things. First of all, we already have a relationship with Cuba. Every year we send public health students and students from the other programs to Cuba. And they see some interesting things about Cuba, which of course is a very self-sufficient economy because of economic embargoes and things that apply to the country of Cuba. But the audience may not know, but Cuba has a indigenous pharmaceutical industry. They were producing their own COVID-19 vaccines, and they produce other medications, including anti-cancer medications, all by themselves on the island of Cuba. So there is this industry. The healthcare metrics for Cuba are pretty outstanding, especially compared to the United States in most areas, and they're doing well. And we do have a relationship with Cuba. We work with the Cuban embassy, and again, we send students to Cuba every year. But I would look forward to an additional conversation and collaboration with this organization as well.
Great. So someone wants to know if CDU is establishing some sort of FQHC network or partnering with some FQHCs in California.
We have, I think, more somewhat deliberately stayed out of the direct provision of healthcare services, focusing on our higher education role right now, with one exception. And the exception is that we operate a program called Drew Cares. And we have a clinic called the Oasis Clinic on our campus. And those entities provide services specifically to HIV-infected individuals who are, South LA is still a flashpoint for the HIV epidemic today as we speak. And so we're providing services, cutting-edge services, medication services, counseling services, and treatment services for individuals in our region today. Otherwise, we've not been directly involved in healthcare. We do work with any number of FQHCs, the Watts Health Center, St. John's, Altamed, South Central Healthcare Clinic, you name it. We're involved with them as we are involved with the LA County Healthcare Delivery System, MLK Community Hospital, et cetera.
Yeah. Well, the next question, I think you kind of touched on this, but someone wants to know if through those FQHC partnerships, are you creating more opportunities for, I guess, more clinical opportunities for teaching or for learning with students?
Yeah, teaching, learning, both. We typically have students from different programs that are on rotations at each FQHC.
Okay. And then I know, Myra, I'm happy to see you. Maria, sorry, happy to see you here. And there's tons of questions. So she also wants to know who can she reach out to if she's interested in creating and partnering or supporting current research activities at CDU.
Well, I would just say that individuals can send me an email directly. And my email address is president@cdrewu.edu. That's president at cdrewu.edu. All one word.
Okay, and hi, Marie. Marie is interested in learning about the steps that CDU is taking to address the maternal mortality crisis, especially given the profound impact on Black birthing people and marginalized communities. Great question.
Yeah, very important question. You know, it became apparent to me some time ago that every African-American woman of childbearing age is asking themselves the question, if I get pregnant and have a baby, is it going to cost me my life or my infant's life? There's fear out there. It tarnishes the joy of motherhood, and it's significant. And that's why at CDU, we've just been funded to open a Black maternal center of excellence, maternal health center of excellence on our campus. It is in operation right now. And we'll be relocating or moving that center from our campus out into the greater community very shortly.
Great. And someone wants to know, how can the business community help with workforce development? Could they sponsor or support career fairs, forums to do outreach and engagement?
All the above. You know, every year we've been fortunate to host the Empowerment Congress here on our campus. We've been doing that, I think, for the last 6 or 7 years, originally started by then Supervisor Mark Ridley Thomas. And that's an example of the work that we do with the business community. And so anytime that we have a university event, we try to include in a variety of roles local small businesses on our campus or work with them to provide services.
Great. I think this is also an important question. So someone wants to know, how do students find housing or obtain housing? Are there dormitories on campus at CDU?
No. We've been for 58 years entirely a commuter campus, but we recognize that when you're trying to recruit young people from, say, Birmingham, housing is an issue. Landing in the great city, expansive, huge city of Los Angeles can be a challenge if you haven't been here before. And as we look at students from other locations, this is an issue. That said, we're starting to enter into the student housing arena very cautiously. We do specifically place students into housing adjacent to our campus, and we're counseling students on where they can easily obtain housing throughout the South Los Angeles community. So this is something that we're working on. We do have a plan to eventually build housing on campus, and that is our long-term goal.
Great. And then someone wants to know about the partnership with King Drew High School and if the Saturday Science Academy is still available and open.
Yeah, the Saturday Science Academy is still open. It's still recruiting and enrolling students. It's on our campus every Saturday. We see the high school students, they're right next door to us, the King Magnet High School for LA Unified School District. We tell their students our campus is your campus. If you're on our campus at 8 o'clock in the morning, you'll see King High School students waiting for their classes to start. Our students interact with the high school students in a variety of ways. Our faculty interact with them. I interact with them directly. We go to their basketball games, we go to their football games, et cetera. And they're a great partner. In fact, I'd say more than a partner. They are an asset, not just for our community, but for our university as well.
Great. So there are just a few more questions. I'll try to pick a couple. We may not get to all of them, but someone wants to know that as a practitioner in the field of climate change, they're curious to know if there are any learning modules or programs at CDU that intersects public health and the climate crisis.
A very interesting question. I can't answer the question explicitly, but when we think about the climate crisis, or we think about the impact of the environment on healthcare, it's local, it's international. We know that right next to us in the community of Watts, we have a lead contamination issue in the water supply. It doesn't get more immediate than that. There is no concentration of lead in one's body that is acceptable. It's all dangerous. And to find it in the drinking water in Watts is a huge, huge issue. You look at flooding, for example, around the world, a major cause of loss of life and impact on the public's health, especially impacting under-resourced communities. Our students are acutely aware of this as a public health issue. Malaria, tuberculosis, all kind of vectored through environmental issues, water that's sitting around, poor respiratory conditions, COVID-19, et cetera, et cetera. These things are all intertwined. If you want to think about health holistically, you have to think about the relationship between health and the environment and pollution, et cetera, et cetera.
Okay. And then this will be the last question, but someone wants to know how CDU supports the sickle cell warrior community or continues to help, and are there any outreach opportunities?
I actually can't specifically answer that question, but I would encourage, I think you have my email address. I would encourage the attendee to send me an email specifically, and I can get back to them with specific information. But we do know that this is part of the reason why we're opening a genetic counseling program, for example. What's the biggest genetically mediated illness in the United States? Sickle cell anemia, obviously disproportionately affecting the African-American community. What do today's genetic counselors look like? Well, they don't look like your typical sickle cell anemia patient. There's a need for diversity in that profession, and we are taking on the responsibility to do something about that.
Great. Well, that was our last question. I know we've gone a little bit over, but I really do appreciate you being here today and sharing with us all the great and wonderful things that Charles Drew is doing. I know here at CBHN, we look forward to continuing to work with you all and expanding our partnership and collaboration. Don't know what that's going to look like in 2025, but I've reconnected with Dr. Vargas, and so he and I are talking about some things, and I look forward to seeing how that unfolds in 2025. So thank you again. Give my regards to everybody on campus, and thanks for your support of CBHN as well. So there's a few more things to cover before we say goodbye today, but thank you again for being here.